Hi, it's Dr. Kenny Levine. Welcome back to Health Talk, seen on WEYW19.com and on UVerse Channel 19. I'm here with Dr. Bob Swinger. Bob, before I forget, I want to ask you a question. Approximately how many veterinarians are there in the United States?
How many veterinarians?
Veterinarians.
Hundreds of thousands.
Hundreds of thousands. How many people do what you do? Veterinary ophthalmologists.
It's about 350. So
you're even more special than I am. I think percentage-wise, there's a lot fewer of you than there are of me as a periodontist. Let's let our viewers know where you're located and how they can get in touch with you.
We have 3 locations. Our primary location is at Hollywood Animal Hospital, which is right at the intersection of 95 and Hollywood Boulevard.
And the address?
2864 Hollywood Boulevard.
Okay.
And then we have 2 more satellite facilities. One is at Miami Beach Animal Hospital, which is in South Beach.
Right.
And then in South Miami at the Southeast Veterinary Referral Center, which is South Miami.
What's the best phone number people can reach you at?
954-826-8871.
You guys have a website they can visit you at?
Yeah, absolutely. www.animaleyeguys.com, and we're also on Facebook.
Now, is your practice solely eyes, or do you practice with other general veterinarians?
In Hollywood, we're fortunate to have a dermatologist, a couple of surgeons, a cardiologist, and then a great group of general practitioners. In the South Miami office, we've got 2 internists, surgeon, and a dermatologist.
Now, when you get called out of your office, you have to go to the zoo, or you have to go to the shelter, or you have to go to the racetrack.
Mm-hmm.
What about bringing your equipment? Do they have equipment there? Do you have to bring the animal up to you? How is that handled?
You know, everything, not everything. Our machine to do cataract surgery, our microscope, those things stay at our primary facility in Hollywood. But the handheld microscopes, the machines to check their pressures and to stain their eyes, and we pack all that up and we travel up, we take it with us everywhere we go.
So on Wednesday, I'm taking my grandson up to Lion Country Safari, and they got a giraffe there. It was really tall.
Yeah.
How would you handle him?
You know, we did a giraffe, and we've actually done some. Back when I was a resident, we went to Lion Country Safari and took care of an ostrich. But a lot of the giraffes, we actually get up on a platform, and just like where you may feed the giraffe.
Right.
But they've got them trained to put their head in the stand and do an exam. A lot of when I was a resident, we were we wanted to check pressures, intraocular pressures, on dolphins.
Uh-huh.
And so the trainers at the
Sea
facility were training these dolphins to come up and, you know, sit still so we could try and check pressures. Those are Brookfield Zoo in Chicago.
Really? I myself have a terrible blink reflex. Whenever anybody goes near my eye, it's a very traumatic for me. I would imagine animals are equally as difficult to work on. Do you have clamps for them to hold their eyes open, things like that?
You know, when I'm doing an exam, there's normally myself and an assistant that are working together. So
right.
My assistant's generally helping hold eyes open. Most of these guys want to see what I'm doing about as much as I want to see what I want to see. So they
cooperate.
They do cooperate pretty well. Most of my patients are referral only, and they're being seen by their general doctor. We basically, what I try and do as an ophthalmologist is just be an extension of their primary care. So general doctors will refer them to me for the eyes only, and then we try and work together to deal with it.
That's interesting because the other evening I interviewed a gastroenterologist who's also an internist. I asked him the same question. He gave me about the same answer as you did, that you know, he'll take care of the problem and then get it back to the referring doctor. And as a periodontist, I do the same thing. I take care of the periodontal problems, the implants, the cosmetic things, but for the general dentistry, they have to go back to the doctor that sent them.
I get a handful of clients that just come in for just a health check. You know, they just want to know there's no eye problems, but they want to prevent things. And so a few things I recommend is keeping the eyes, you know, the hair around the eyes clipped short. You know, a lot of pets get they need groomed more often than they do, and that builds up a lot of debris. So keeping the hair short, keeping them clean around their eyes. Bulgy-eyed dogs, you know, using lubricants, over-the-counter lubricants, especially before bedtime, I think are great. There's a great ocular supplement that we use right now called OcuGlow, which a lot of ophthalmologists are carrying. It's a super antioxidant. These are things that aren't going to hurt anything. How much benefit all these things have, I don't know.
We
but,
don't know.
but
Well, you know, in our practice, we want to get as many people through the door as we can, and we
Mm-hmm.
welcome our patients to come in for free exam consults and x-rays. And I wish I knew all the things about veterinary medicine that you do. I'm going to ask you to come back another time. And Bob, thank you for coming in.
Hey, thank you.
And I look
Appreciate
forward
it.
to seeing you again. It's Dr. Kenny Levine with Health Talk. We'll see you next week. Thank you.